Hello and welcome to another segment of the Advisory Health Council's Wellness Spotlight. My name is Dr. Ken Friedman. I'm here with my special guest today, Dr. Michael Rothman. You know, in this day and age, we're barraged by commercials on television and throughout the media about new varieties of drugs. And people today, being more interested in wellness, are interested in getting off drugs. What is a person to do? We have a special find in East Brunswick, a medical doctor who's been specializing in wellness long before it became fashionable. I'd like to introduce you to Dr. Michael Rothman. Welcome to the Wellness Spotlight.
Thank you, Ken. It's great to be here.
Mike, tell us a little bit about your background and your experience. Where did you go to medical school? Where did you grow up? And what made you settle in East Brunswick?
Well, I grew up in Westchester County. I went to college at SUNY Binghamton. I was a physics major. I went to medical school in University of Miami in Florida. And I ended up in East Brunswick because I did my residency in internal medicine at Mountainside Hospital. And then a lot of different interests kept me in this area.
So you're an internist, and I also understand you practice emergency medicine as well.
Yes, I trained in internal medicine, and I've been practicing emergency medicine for 20 years now.
And what was it that drew you into practice medicine? Why did you become a medical doctor?
Well, actually, I wasn't planning on becoming a medical doctor. I was a physics major, had fantastic grades, and a lot of my colleagues were pre-med. A lot of people said, oh, you should go to medical school. But I really wasn't that interested. I was going to become a biomedical engineer. My second year in college, however, I became very ill. I had a very debilitating illness, and it drew me into medicine in terms of interacting with doctors. And my experience with them was really not very good. That experience and things that occurred after that, I was able to actually help myself through mind-body techniques, through taking care of myself, and it seemed to help more than the doctors were able to help me. This got me interested in medicine, and I thought maybe I should go to medical school and try to see if I could help other people using these techniques.
And tell us a little bit about your practice and what it is that makes your practice so atypical from typical medical practices.
Well, Ken, a lot of people would call my practice alternative, and I use that term as well only because it's familiar to people. But I would really call it functional medicine or metabolic medicine or nutritional medicine. And really my practice is based on trying to help the patient to achieve metabolic and nutritional balance so that they don't have symptoms in the first place, so they can avoid illnesses. And
what types of people consult with you? Or is there a certain group, a demographic, or, you know, give us, you've been a practicing medical doctor, practicing this type of medicine for how many years?
I've been doing this full-time for 5 years. I dabbled in it for several years before that. Most of my patients there's really no typical patient, but typically it's someone who has sort of slipped through the cracks. They've been to this specialist or that specialist, and they just can't seem to find answers, and they're looking for really anything. A lot of my patients are very desperate. They oftentimes have very chronic problems like fatigue or bowel problems or hormonal problems or pain problems, and they just sort of don't fit into any particular category and have found that that medication doesn't seem to help them.
So these are people that are pretty much at their wits' end. They've gone the traditional medical route and they don't know where else to go.
Yes.
Now, with the people that you see and attract, give us an idea about how it works when someone comes to you. What is it that you do?
Well, I'm trying to discover what it is that caused them to be sick. The first thing I would do is I ask them why you're here. What is it, you know, what are your main complaints? I go through what's considered called a review of systems, just going through sort of sequentially from head to toe what symptoms they have. And then I'll ask them what they eat. I want to know every single thing that they're going to eat, typically in a day, what they eat for breakfast, lunch, dinner, what they snack on, what foods they consume. I need to get a sense of their lifestyle, what kind of hours they keep, what kind of stresses they have in their life. This really is a holistic approach because I want to sort of see what is it in your environment, whether it's external or internal, that's causing you to have all these problems.
Now, once you have the history taken, are there any special diagnostic tests that you do, blood work, things like that, that in addition to the history give you good information?
Oh, absolutely. I do a very thorough physical exam, and I look for clues that a lot of other doctors really wouldn't consider to be important, you know, looking for things in the patient's eye or on their tongue or their skin temperature, what their pulse is like. I'll check body fluids like saliva and urine, checking the reflexes. There's so many things, so many clues that the body gives us that are really mostly underappreciated in mainstream medicine. And then I'll also order tests as needed, blood tests, some of them relatively traditional, some of them are a little more exotic. And it's not necessarily the tests themselves, but it's the way I interpret these tests. And nothing is looked at by one single parameter. It's really taking everything, the totality, their symptoms, their physical exam, the tests that I run, etc., and putting all of those things together to try to find out really what is causing this patient's problem.
I found in my own practice that when a patient presents, you're almost like an artist putting a mosaic together. You know, you could have a piece that looks blue, but that could be the sky, it could be the ocean, it could be the blue of their eye. One piece doesn't tell you the whole picture. So by looking at all these component pieces together, you have a much better idea, and that's what you do in your practice as well.
Yes, exactly, Ken. And in fact, the metaphor that I like to use is this jigsaw puzzle. You know, there's this piece here, but unless you've seen the whole picture, you don't know where that piece goes. The other thing that I like to talk about is connecting the dots. That old puzzle where you have a dot here and a dot here. If you just have two dots, well, all you got is a line. But once you get enough dots, then you can actually start to see a picture.
Now, I'm sure you'll agree that this is very different from the way that most people practice medicine. Most people that go to a medical doctor don't have an experience like this. Why don't more MDs practice the way that you do?
Well, that's not really the way that we're taught in medical school. Medical school training, you're taught to diagnose diseases based on very specific things, very specific symptoms or specific laboratory parameters or laboratory values are then given a disease. For example, I was given the name of a disease. I was told that I had Crohn's disease based on the fact that the blood test showed this and the x-ray showed that, and therefore I had Crohn's disease. And so they're looking for things that are broken. I'm looking for things that just don't work right. So it's the difference between something that's broken and something that's just not functioning correctly. So it's more of a, it's a totally different approach. And
once you're able to understand what's happening in that patient, what's the approach that you take next? Do you prescribe drugs? What is it that you do?
Well, I do occasionally prescribe drugs, and but that's usually not something that I would start with. In fact, many of my patients are on a lot of drugs when they come in to see me. The first thing I do, Ken, and this goes for every single patient, is that I have them change things in their diet, because almost every patient that I see, no matter how careful they are, no matter how hard they're trying to be healthy, is invariably eating something that's actually either not good or it may even be poisonous to them. So that's the first thing. Take out things that I know are not good for this patient. Start with that. And then I would start to investigate, you know, their biochemistry. They're using these different tests that I had mentioned previously.
Now, in addition to prescribing medication at times, what other things do you do to be able to help your patients? Do you prescribe any nutritional approaches? You recommend certain changes in diet. Do you also advise them to take certain supplements that could help them?
Yes, I do prescribe or recommend supplements to my patients. But I'm not using the supplements to treat their symptoms. In fact, I tell my patients, I'm not going to treat your symptoms at all. I'm not going to ignore them, but I'm going to try to find out what's causing your symptoms in the first place, and then treat the cause of your problem. An example, just a very simple example, would be, for example, magnesium. A lot of people may have a magnesium deficiency, and this could manifest. This could exhibit signs of high blood pressure or fast heartbeats or headaches or anxiety, and therefore they may be magnesium deficient, causing